Hi, this is Dr. John McCormick, and we're here for our next episode of The Pulse of Healthcare. And today I have with me Kevin from Easy Digital, RPM1, and so unique in the marketplace, and they do such a great job of doing something that almost nobody does. And so RPM means remote patient monitoring. And anybody that's been in the space for as long as we have knows that being able to monitor members outside of the clinical setting where they're, at home, where we can, check their pulse, make sure that their blood sugar is good, check their weight and those kind of things, understands that the logistical hurdles for a health plan on that can be enormous. One, you've got to have the right equipment, you've got to deploy it to the member's house, but really what you have to do is get the member to use it. So all the best intentions in the world don't actually equate to utilization, and they don't actually equate to proactive healthcare. So I was just like blown away when I met Kevin and his team, and they came to me and said, not only can we do this in a super cool proactive way, but we can do it in such a way that we can interface with devices that are already in the market. And I was like, wow, this is somebody I got to get to know. This is somebody I need to partner with. So, Kevin, tell us a little bit about Easy Digital, the platform, and how that all works.
Yeah, absolutely. The inspiration came from a large trial I led on behalf of the National Institute on Minority Health and Health Disparities. So during COVID, we were all desperate for solutions. We deployed things like cheap Fitbit devices to medically underserved populations, but at a very large scale. Native American reservations, rural cities, a bit of inner city communities as well. And throughout this, just using EHR data, metadata, and data from things like Fitbit devices, I proved at a large scale that we could predict respiratory illness several days prior to symptom onset. Right? The concept is your physiology changes that results in symptoms. Symptoms result in an event. Took the results back. Ultimately, the NIH saw some issues with commercialization, and looking in the rearview mirror, they were correct. There was a lot of issues around, as you mentioned, patient engagement, interoperability, clinical staffing, and so on. So I partnered with a gentleman, helped me on the operations side, and what we built here is Easy Digital. Beyond remote patient monitoring, we're consolidating a number of digital health services and coming in with a fully capitated arrangement. Ultimately, we connect to every device that essentially has been manufactured at scale in the United States. So everything from Fitbits and Apple Watches to every scale, blood glucose monitor, blood pressure cuff, pulse ox. 100 million people already have these devices in their home. The problem is today, the burden of interpretation is on the patient themselves, right? Ultimately, not very qualified to understand, minute changes in their blood pressure or their heart rate. They just frankly don't know what to do with that data. So what we do is we passively connect to that data. We perform pretty complex monitoring. I won't bore your viewers with all of that, but what we're very good at is detecting the earliest changes of basically signs of change in their health status. So we detect something's going wrong, and then we get them care sooner for cheaper. That's ultimately the model.
I love that. I just love it. I mean, so many times, and I was an educator for about 10 years before I got into the healthcare space, and I'm going to say teachers are the worst. I love them. They're the best and they're the worst. And they're the worst with their healthcare because they're so dedicated to their students and being there every day. And I know I was one of them. It's like I would rather be sick and show up than try to get a substitute to come in and take care of my classroom. It was more work, and it never felt like they got the same quality of instruction. So teacher would get some kind of respiratory infection, and just maybe a little sniffle, and then drag it on all week. And then by the time they hit the weekend, they got pneumonia, and if they'd been in your program, they'd have been like, hey, alarm bell's going off, boop, 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 go get your Z-Pack,
Yeah. The concept is, the idea of prevention, right? It's cost savings, it's improved patient outcomes, but no one's really figured that out at scale. Right, the idea of detecting something early enough to where you can route them to a lower level of care or prevent a catastrophic issue, and really we're just doing it a little bit more seamlessly than call it the competitors. Right, we're using devices patients already have that are continuously transmitting very important health data, right? These wearable devices are collecting the same data points that if you were to go show up at an emergency room right now, but we're doing that continuously. We're taking in things like their symptoms. If they report symptoms, now there's actually somebody there listening to it. It's AI ultimately. We're looking at these early changes in health, saying, hey, let's talk to you, see if there's any other symptoms that may be going on. Ultimately decide, do you need to see a doctor, yes or no? And if they need to see a doctor, that's capitated as well. It's included in their membership, and they can see a doctor within 7 to 8 minutes at absolutely no cost. So it really is about bringing transparency, predictability to those that don't really have direct access to healthcare today.
Right. And so just to remind everybody, capitated means it's included in the cost of the service and you never have to pay an extra dime. So that's so critical. Again, we're about removing barriers. We're about being proactive. These are all the things that's going to help an individual control their healthcare spend, a company control their healthcare spend, and even the government. If they'll just turn on and join with us, they can help actually control their healthcare spend for Medicare, for Medicaid, for all of these programs that are really out of whack with what the actual care could be, the care spend could be, if they actually were proactive. So there's always a lot of conversation about we're going to do great things and we're going to be proactive and we're going to have these wellness programs and things like that. But when you look at the data, you find out that that really didn't do anything.
Yeah, absolutely. I mean, the most expensive avoidable part of healthcare in the U.S. health system is health inequity. It's $320 billion per year that's considered completely avoidable simply because people don't have access, uninsured or underinsured that have the high deductible plans and they don't seek care, right? These are avoidable medical expenses. And our sole mission is to basically prove to them it's more cost beneficial to provide care to these populations, the underserved, than it is to not. Because they do still get sick and they still go to the hospital, but for $20 a month, let's route them to primary or virtual care or something like that as well. So we want to provide health care to everybody, but the route for widespread adoption is through cost benefit. And that's what we believe we're well positioned for and ultimately going to accomplish.
Man, it's so exciting. I mean, very rarely in this space do we get the opportunity to work with people that are really what I would consider out on the cutting edge. There's a lot of people that pretend to be on the cutting edge, and then they get to somebody like me that's been in the space for a long time, and I'm like, no, that's a 10-year ago idea. So when I run across somebody that's truly innovating and truly in the space in such a way that I can easily see this is going to be effective. This is going to actually make things less expensive. This is actually going to deliver a real quote unquote benefit to the employer, to the employee, to the individual member that might be out there that they may be on that gig economy and they're a realtor or something like that, and they're making too much money to qualify for a subsidy in the ACA plan, but they still want to have that level of they want to have a policy like that, but the only one they can afford has a $4,000, $5,000, $6,000 deductible. Now we've got a product that we can roll in, underneath that and actually give them some direct, immediate, not only monitoring, but care to help bridge that between avoiding care, like you talked about, because that's what people do, and actually getting proactive in their care so they don't end up in the emergency room or the hospital when it was completely avoidable.
Yeah, absolutely. There's communities that have trust issues with the health system. And I would say that's our biggest barrier to overcome here. Ultimately, it's like, hey, we're just trying to do this good. We're going to treat your data properly, and we're taking the right steps as we discussed today, going through the FedRAMP process and so on. But it's the solution that I saw the need for when I was working in these communities, embedded myself in these communities for about 2 years, and got to see a mother and her child with an ear infection, and they were too worried to go to the hospital because they were uninsured, had no idea what that would cost them, and ultimately that ear infection progressed into an emergency hospitalization and a little kid. This solution, we could have gotten that doctor's visit for a flat rate fee, again $20 per month, and delivered a medication to that door, a Z-Pak or equivalent, for less than $2. And there was so much money wasted, but the human impact of that as well. So when we felt like we had the opportunity to create this solution, both from an expertise and kind of the will and want to do it, we felt obligated to. And we're still early on, but we're starting to chip away, have a really good opportunity to go, move the needle a little bit in New Jersey here come 2024. But we're just getting started. There's a lot of people that need what we're trying to provide here collaboratively.
Awesome. You said two things that I just want to touch on before we wrap up for today. First of all, you mentioned AI. People, AI, especially today. It's like, what are they going to do? They're going to take my data and it's going to end up all over and in China and whatever. All right. And then you said FedRAMP. And both of those things are connected in such an important way. So describe what that means.
Yeah. AI, obviously a hot topic. Everyone's a little scared of it. There's just things that are undoubtedly better for AI to do than humans, right? If you can imagine remote patient monitoring, imagine one nurse sitting in a room monitoring 3,000 patients' data simultaneously.
It's impossible.
We're
Can't do
talking
it.
about per second heart rate data coming in. It's just not feasible, right? And that's about what you would have to do for that to be economical. One nurse per 3,000 patients. It's never going to make sense, right? We do AI, right? So as opposed to that nurse trying to do it, what we do is baseline adjusted variance. So we're saying, hey, Dr. John, your resting heart rate is 76.3 beats per minute plus or minus 1.5. There's always a little variance. And AI is scoring risk on a per second basis. And this is how we're detecting the earliest sign of change. We do this metric by metric and ultimately say, all right, there's something wrong here, right? There's a non-specific change. We're just AI. We're not going to diagnose you. What we are going to do is push you to the next level of care, a doctor, right? And we're going to get you in front of that doctor cheaper and sooner so that issue that may have resulted in, who knows, a heart attack could have been intervened earlier. So we're putting AI in the places where we believe it makes sense, right? These tedious jobs that humans are intrinsically limited at, and leaving humans to do what humans should do, which is decision making and treatment and new prescriptions. All of this, what we do entirely is all AI. Anytime there's a human involved like the doctor, we're pushing to a third-party network. Some great relationships you brought to the table. So we're infinitely scalable. It's all software. Well, when you have software and you're basically, very precious data that you want to protect, you have the obligation to take that very seriously, right? Cybersecurity. So everyone's probably heard of HIPAA, right? Kind of the baseline. This is what you have to do with patient health information. One level above that is what's called SOC 2 Type 2. And this is ultimately where you go to a third-party agency and you allow them to audit you for a 3-month period and then kind of incrementally after that. So that's saying not only are we compliant, we're checking the boxes, but somebody independently verified that we check those boxes. And then there's this animal called FedRAMP. And it's very not well known. It's very difficult to get. It takes about 2 years, upwards of $5 million. But what it is the highest level of cybersecurity certification checked off by our federal government. It's not a third-party accounting agency. It is the federal government that comes in and says, yes, you are protecting data to the highest standards physically possible. Well, that's great. Obviously, it builds a lot of trust with our community. We're not selling their data. We're not mistreating it. But from a business perspective, it basically puts us in the little catalog of prestigious companies that the DoD, the VA, CMS, and other big federally funded agencies can source from. So, we're doing it because we believe that's how patient data should be treated, but it's going to open up some big doors that's going to allow us to help a lot more patients as well.
And I think that's so important. I mean, all of us have been in the healthcare space and the insurance space. We know that cybersecurity is so critical. And even some of the biggest players in the market have been hacked and their data compromised and things like that. I can tell you they're not FedRAMP certified. They're not. And it doesn't mean that they're not trying to do a great job in cybersecurity, but that space evolves so dynamically all the time that you've got to have a company that's aware of that, that's focused on that, and is constantly complying with those kinds of things. And I think that's really a differentiator for your company. So many companies, can say, well, we have a cybersecurity program. Yeah, okay, now, but you were hacked 2 years ago, and my data's still floating around out there. But the fact that you kind of built it in on the front end, that kind of situational awareness, I guess, is a big differentiator when you're talking about patient data and especially, monitoring people remotely, so important that we bring that to the forefront.
Yeah, absolutely. Again, it goes back to building trust, right? That is the hurdle. That is what we're attempting to overcome. When you have this stamp of approval, of course, education, no one's heard of FedRAMP, but ultimately that means at the highest level you're treating data with the highest ethical standards possible, right? And you put a lot of money into proving that is that way as well. So simultaneously, not to toot our own horn, but we're investing in things like that are extremely important while simultaneously working on extremely, extremely low margins, right? The closest competitor to us, if you will, billing the old fee-for-service way, they're billing $120, $200 per patient per month for equivalent services. And we're saying $20 and we'll never raise our price because that is accessibility. That's how you get health plans to realize cost benefit and provide it not only to late stage sick people, but ultimately everybody. And that's what we believe. There's, again, 40 million people with an Apple Watch, 100 million people in our country with devices already. Let's start monitoring them, right? That's how you build, maybe not even fix a health system, you build a new one that's a little more proactive.
I love it. I love it. Well, thank you for coming and sitting down with us today, Kevin. It's been amazing to talk to you. And we'll see everybody next time on the Pulse of Healthcare. Thank you.